This is the Coronavirus Morning Report for Monday, April 20th, 2020. I'm Brian McCullough. Re-upping our concerns for specific hotspots as flare-up potentials, including prisons, factories, and nursing homes. More data that the curve has indeed flattened into a plateau, but it's not yet dropping. More good news about Remdesivir, more data linking obesity to severe COVID outcomes, and worrying news that the first antibody tests are having some serious problems. The coronavirus death toll in the U.S. surpassed 40,000 over the weekend. Deaths in Europe will pass 100,000 today or tomorrow. And over the weekend, Europe reported its millionth coronavirus positive test. Today is the day that Germany begins reopening small stores and shops. Stores no larger than 8,600 square feet are able to reopen, providing shoppers maintain safe distance from each other. Businesses in Denmark are reopening today as well, including hair salons, tattoo artists, and physiotherapists. Elementary schools in Denmark reopened last week. We've mentioned a couple of times being worried about single locations proving to be hotspots for coronavirus flare-ups or even re-flare-ups, as apparently happened in those migrant camps in Singapore, for example. And we've also been keeping our eye on prison cases around the globe, almost from the very beginning. Well, this would be that. The Marion Correctional Institute is 60 miles north of Columbus, Ohio, and it is reporting that 1,800 inmates, nearly three-quarters of the entire prison population in that single facility, has tested positive for coronavirus. The fear is obviously that these cases will spread to the wider population, and indeed a glance at any of the tracking sources shows that Ohio graphs have been surging over the weekend and the last half week. Another thing we've been watching, quoting the Washington Post, nursing homes will now be required to report all coronavirus cases to patients, families of patients, and the Centers for Disease Control and Prevention, officials announced at Sunday's White House Coronavirus Task Force briefing. It's important that patients and their families have the information they need, said Seema Verma, the administrator of the Centers for Medicare and Medicaid Services. Quote, and they need to understand what's going on in the nursing home, end quote. Yes, there have been worrying signs that the case count and death rate in nursing homes worldwide, frankly, might be far worse than currently known. And the problem, again, is similar to what I just said. Any institution or facility that becomes a hotspot is a potential problem for the community that contains it. Because naturally, any facility has outside workers from the community servicing that facility. In short, our community institutions are just that, part of any community. Quoting again, Verma framed the new policy as an effort to help federal and local officials contain the spread of the virus, especially as the country attempts to reopen in the future. Quote, this will support the CDC's effort to have surveillance around the country and to support efforts around contact tracing, she said, so we can mitigate the spread of the virus in communities that show spreads starting in the nursing homes, end quote. Emphasizing this a third time, with another thread we've been following, Iowa on Sunday reported its largest daily count of new confirmed cases, as about 260 new cases were confirmed at a national beef factory and multiple Tyson food factories. At this point, 67% of the statewide corona cases in Iowa have come from meatpacking industry facilities. Let me give you one more example about community hotspots from the very community where I live. One single elder care facility in Cobble Hill, Brooklyn, the Cobble Hill Health Center, a 300-bed facility in Brooklyn, reported 55 coronavirus deaths over the weekend. 55 fatalities in a 300-bed facility. There are also 4 other nursing homes in New York that have reported at least 40 deaths, and 19 homes in the state of New York reporting at least 20 deaths or more. Having noted that, more statistics from Governor Andrew Cuomo that New York is appearing to be past the peak of coronavirus. But the governor also said, quote, remember, you still have 1,300 people who walked into the hospitals yesterday testing positive, Cuomo said. So it's no time to get cocky, and it's no time to get arrogant. We still have a long, long way to go and a lot of work to do, end quote. And I want to end this segment with a tweet storm from Bloomberg opinion economics writer Noah Smith. Noah is talking about one of the big things that I mentioned from last week. We continue to see plateauing numbers everywhere in terms of new coronavirus cases. Plateauing, but not yet dropping. Plateauing in infections, in deaths, the whole nine. We've bent the curve. It certainly feels that way, but we haven't broken it. Noah's posts are always replete with up-to-the-minute graphs and data, and this thread is no exception. Link is always in the show notes. Quote, a depressing precedent. Washington State, the first to get infected, has never really managed to bend its curve. It looked like infections were falling, but nope, bounced right back up. New Jersey has been on a plateau for more than 3 weeks. The state is locked down, yet it gets a steady 3,000 to 4,000 infections per day with no sign of decrease. California has a low case growth rate, but has still been plateaued for more than 3 weeks with about 900 new cases every day. No sign of curve bending. Massachusetts, same story. The U.S. epidemic as a whole might be slightly declining, but at a pretty glacial rate. It seems possible that our half-assed lockdowns are simply not capable of suppressing the rate of infection in any reasonable time frame, as Italy and Spain managed. The bad news? At this rate, we won't be under 1,000 new cases per day in the U.S. until August. The U.S.'s coronavirus response thus continues to look like the worst in the developed world. Our economy is suffering just as much as others, but unlike others, we are not actually suppressing the epidemic. Hopefully this changes soon, end quote. The U.S. and South Korea, as we've said multiple times, confirmed their first coronavirus cases around the same time in late January, but the two countries have massively diverged in the number of infections they've reported since. While the U.S. now has topped 730,000 infections, South Korea successfully flattened the curve in March and reports just over 10,000. The reason for the difference? South Korea successfully implemented a mass testing and contact tracing regime. The U.S., despite daily claims from the president to the contrary, has not yet. The consequence, South Korea is reopening its society while maintaining a low number of new cases. Much of the U.S. remains under stay-at-home orders while reporting a high but plateauing number of new cases per day. And so, Bloomberg reports, South Korea is going back to work and something approaching normal life. National elections were held successfully last Wednesday. The Apple Store in Gangnam has reopened, requiring customers to wear masks, stand 2 meters apart, and have their temperatures checked before going in, but reopening nonetheless. Cafes and parks are once again bustling with people, albeit wearing masks and keeping their distance. And of the potential for a second wave, the government remains cautious, quoting from Bloomberg. Fearing the potential for a second wave of infections, Korea's Centers for Disease Control and Prevention urged everyone to continue to follow social distancing and personal hygiene guidelines during the weekend. We cannot put our guard down yet, as there are still potential for high rates of infections, Vice Health Minister Kim Ganglip said in a televised briefing Saturday morning. We believe that we need to continue social distancing and not loosen it up, end quote. In the meanwhile, Kim said, South Korea's government is drafting guidelines for a return to a new normal, including modifying quarantine procedures and social distancing measures. Our society has been successfully delaying the spread of COVID-19 virus through social distancing, he said, but that does not mean that the virus disappears completely or we are able to return to life we had led before the outbreak, end quote. What is clear is that the U.S. needs to dramatically ramp up testing for us to get anywhere close to the progress South Korea is making on reopening its society relatively safely. Indeed, a piece in the New York Times, linked in the show notes, suggests that we need to approximately triple our testing rate. Instead, testing here is leveling off, as we mentioned last week. We can and we must do better soon if we are going to reopen this summer. Following up now on a story we covered Friday about the Gilead drug Remdesivir, there are more positive signs that it could be an effective treatment for COVID-19, especially if administered early in the course of the disease. A National Institutes of Health study involving 12 rhesus macaques indicated that early treatment with Remdesivir, quote, significantly reduced clinical disease and damage to the lungs of the monkeys. The study, which was designed to follow dosing and treatment procedures used for hospitalized human COVID-19 patients in a larger clinical trial, is yet another piece of evidence that suggests the drug has some benefit. The NIH explained, quote, "One group of monkeys received Remdesivir, and the other animals served as an untreated comparison group. Scientists infected both groups with COVID-19, and 12 hours later, the treatment group received a dose of Remdesivir intravenously and then received a daily intravenous booster dose thereafter for the next 6 days. The scientists timed the initial treatment to occur shortly before the virus reached its highest level in the animal's lungs. 12 hours after the initial treatment, the scientists examined all animals and found the 6 treated animals in significantly better health than the untreated group, a trend that continued during the 7-day study. They reported that 1 of the 6 treated animals showed mild breathing difficulty, whereas all 6 of the untreated animals showed rapid and difficult breathing. The amount of virus found in the lungs was significantly lower in the treatment group compared to the untreated group, and COVID-19 caused less damage to the lungs in treated animals than in untreated animals. The investigators note that the data supports initiating Remdesivir treatment in COVID-19 patients as early as possible to achieve maximum treatment effect, end quote. The authors did note, however, that though Remdesivir appeared to help prevent pneumonia, it had no effect on the amount of virus being shed by the animals, i.e., they remained just as infectious, which is an important finding in the context of infection control in hospitals. The authors did note, however, that although Remdesivir appeared to help prevent pneumonia, it had no effect on the amount of virus being shed by the animals, i.e., they remained just as infectious, which is an important finding in the context of infection controls in hospitals. Multiple studies have now found that obesity is linked to people experiencing more severe cases of coronavirus, including higher hospitalization and higher death rates compared with non-obese patients. Most surprisingly of all, this was found to be the case especially among younger patients. So this might solve some of the mystery as to why younger patients here in the U.S. seem to be suffering more than they did in other countries. A U.S.-based study that analyzed data from more than 4,000 patients at NYU Langone Health last month found that obesity was a bigger risk factor for hospitalization than high blood pressure, diabetes, coronary disease, cancer, kidney disease, or pulmonary disease, according to the New York Times. None of the studies have pinpointed precisely why obesity is such a huge risk factor for severe coronavirus disease, but there are some theories out there. Quoting again from the Times, some coronavirus patients with obesity may already have compromised respiratory function that preceded the infection. Abdominal obesity, more prominent in men, can cause compression of the diaphragm, lungs, and chest capacity. Obesity is known to cause chronic, low-grade inflammation and an increase in circulating pro-inflammatory cytokines, which may play a role in the worst COVID-19 outcomes, end quote. Nearly 80 million Americans are obese. We have one of the highest obesity rates in the world, much higher, for example, than China and Italy, quoting from the Times. The new findings about obesity risks are bad news for all Americans, but particularly for African Americans and other people of color who have higher rates of obesity and are already bearing disproportionate burden of COVID-19 deaths. High rates of obesity are also prevalent among low-income white Americans who may also be adversely affected, experts say. More than half of COVID-19 deaths in the United States so far have been in New York and New Jersey, but the new findings mean the coronavirus could exact a steep toll in regions like the South and Midwest, where obesity is more prevalent than in the Northeast. Quote, if obesity does turn out to be an important risk factor for younger people, and we look at the rest of the United States, where obesity rates are higher than in New York, that will be of great concern, said Dr. Roy Gulick, chief of infectious diseases at Weill Cornell Medicine. We may see a lot more younger people being hospitalized, end quote. Stores are empty, travel is on pause, work is uncertain. With social distancing, we need support now more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Match with a licensed therapist from the safety of your own home. 1 month on Talkspace costs about the same as a single in-person therapy session, but with unlimited 24/7 messaging access and daily engagement, there's no need to wait for relief. We all need to talk through life's challenges, and Talkspace offers the support that we deserve at a price we can afford. Match with your perfect therapist right now and get $100 off your first month with promo code BRIEFING. You can get that by signing up at Talkspace.com or downloading the Talkspace app. Don't forget to use promo code BRIEFING, BRIEFING, for $100 off your first month with Talkspace. Obviously, for all our sakes, we need to avoid crowds in any way we can right now. But what if you need to go to the post office? What if you need postage to send out letters and packages? Don't worry, Stamps.com is here to help. Anything you can do at the post office, you can do at Stamps.com. Print postage on demand and skip those lines and crowds at the post office. Stamps.com brings all the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. Whether you're a small business sending invoices, an online seller shipping out products, or you're just working from home and need to mail stuff, Stamps.com can handle it all with ease. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send it. Once your mail is ready, just leave it for your mail carrier, schedule a free package pickup, or drop it in a mailbox. No human contact required. It's that simple. Right now, our listeners get a special offer that includes a 4-week trial plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing. Stay safe, my friends. Saliva tests, as opposed to drawing blood or sticking a swab deep into people's faces, might be a less invasive way to test for coronavirus, thus making coronavirus testing more palatable and scaling up quicker. Saliva tests like the one recently approved under emergency authorization by the FDA could help massively ramp up the U.S. testing capacity, which of course we'll need in order to get the economy reopened. Andrew Brooks, the Chief Operating Officer and Director of Technology Development at the Rutgers University lab that developed one of these new saliva tests, told ABC News that the testing process could look similar to the at-home DNA collection process already used by companies like 23andMe and Ancestry.com. Quoting from ABC News, unlike a genealogy company's DNA review, this test would need to be prescribed by a physician and potentially supervised via telehealth, Brooks said. And the results would need to be reported to the Centers for Disease Control and Prevention by a physician. Quote, it'll be a different overall experience because we're making a medical diagnosis here, Brooks said. But the process is the same. And for people that don't have cars, that don't have access, that are on quarantine, it makes it more broadly available, Brooks said. We're hoping very soon that may be very well possible, end quote. For its part, 23andMe said it had examined the possibility of using its saliva collection tubes for at-home COVID-19 testing, but was not able to proceed at present. A spokesperson told ABC News, our collection kit is designed to preserve DNA and unfortunately does not have a buffer that preserves viral DNA, which is more delicate. We have explored steps to address this, but it is a significant change to our supply chain during a time where many suppliers are necessarily operating at minimal staff, end quote. Dr. Catherine Ball, Ancestry's chief science officer, told ABC that the company has shared its test kits and preservation fluid with several labs across the country and, quote, are hopeful that we can make a positive impact if it works, end quote. However, it may be some time before at-home testing becomes widely available, although the FDA has given emergency authorization to testing of the Rutgers test. It is not authorizing any at-home testing at this time. On its website, the FDA says, quote, at this time, the FDA has not authorized any test that is available to purchase for testing yourself at home for COVID-19. The FDA sees the public health value in expanding the availability of COVID-19 testing through safe and accurate tests that may include home collection, and we are actively working with test developers towards this goal, end quote. And of course, in addition to the need of ramping up testing, we've said many times that there is a crucial need for antibody testing to confirm whether a person has been infected with COVID-19 and is therefore likely to be immune. As rollout of such testing has gotten underway here in the U.S., however, there are worrying signs we might be looking at a repeat of the bungled launch of diagnostic test kits back in early February, quoting the New York Times. The Food and Drug Administration has allowed about 90 companies, many based in China, to sell tests that have not gotten government vetting, saying the pandemic warrants an urgent response. But the agency has since warned that some of those businesses are making false claims about their products. Health officials, like their counterparts overseas, have found others deeply flawed. And the federal guidance that does exist is so confusing that healthcare providers are administering certain tests unaware that they may not be authorized to do so. Some are misusing antibody tests results to diagnose the disease, not realizing they can miss the early stages of infection. Quote, "People don't understand how dangerous this test is," said Michael Osterholm, an infectious disease expert at the University of Minnesota. "We sacrifice quality for speed, and in the end, when it's people's lives that are hanging in the balance, safety has to take precedence over speed," end quote. Of the antibody tests currently available, the New York Times reports that most produce false positives at least some of the time, and there are fears that manufacturing shortages could slow down the production of tests, just as they have for the diagnostic tests. When it comes to the actual antibody tests, the products vary widely. Quoting again, "Some test only for a transient antibody that spikes when the body is in the throes of an active infection. An antibody that peaks about 4 weeks after infection and marks longer-term immunity is a separate target. There are tests that look for both antibodies and others that also look for a third involved in respiratory infections. The most reliable ones involve a laboratory technique called ELISA that can indicate the amount of antibodies a person may have. Higher levels generally mean a stronger physiological response, but it is unclear what levels are needed for immunity to the new coronavirus or how long it would last," end quote. Most of the companies involved in these tests are focused on producing rapid tests, which are easier to administer, but much more unreliable. For that reason, the World Health Organization actually recommends against the use of such tests. As it tries to cut down on the number of unreliable or misleading test kits out there, the FDA has so far approved just 4 out of the 120 antibody testing developers who have submitted requests for emergency use authorization. The companies who have received formal approval are Cellex, Ortho Clinical Diagnostics, Chembio Diagnostic Systems, and the Mount Sinai Laboratory. But even some of those companies have high false positive rates, like Cellex, whose false positive rate is 5%, which, as the New York Times points out, is hardly useful in a community where only 5% of people have been infected with the virus. Fortunately, researchers at the National Institutes of Health are doing head-to-head trials to determine which of the tests are reliable. Dr. Alexander Marson, one of the leaders of the project, told the New York Times, quote, "The ideal outcome is not to pick a winner, but to pick as many winners as possible so the world can have a diversified list of tests," end quote. Hopefully that is exactly what will happen because, as we've said many times, mass-scale testing is vital to reopening parts of the society. As Governor Cuomo said last week, the more testing, the more open the economy, end quote. This podcast now has a Facebook page. It is facebook.com/coronavirus morning report. Coronavirus morning report being all one word. We're going to use this Facebook page like we've been using my personal Twitter account. We'll be posting stories we're considering all day long in real time, so you can follow along with us as we see the news as it happens. So please like and especially hit the follow button on that page if you want to be on top of the news every hour. And we'll also be posting all of the show episodes there as well. So please repost those as they're released every morning to turn your friends and family on to this show as well. Again, that is facebook.com/coronavirus morning report. There's a link at the very bottom of the show notes.